Yeah, look, and it's a really important discussion because, most families will, certainly in Queensland, they have a program where kids go through a sight screening in their prep year of school. It's nice to kind of talk about how the different terms like sight versus vision are used. And a
Mm.
lot of the time, people might be using the word vision, but they really mean sight. So it leads us into a lot of vision screenings are really um, concentrate on the sight side of things. So sight is how clearly we can see, and that's typically measured by what you can see on a letter chart. And when you're dealing with kids, they tend to use pictures instead. And sight screenings have a really important role for picking up those types of eye and major eye and vision problems that develop before the age of 4. And things where, because the kids develop those things young, they may not necessarily outwardly show any kind of issues because they just kind of learn and develop with the vision problem in place. But it then can cause some issues later on. And so a lot of the testing centers around whether they've got a high prescription, so that's whether they've got astigmatism or long sight or short sight, how well they can see on a letter chart, and whether there's any difference between the two eyes. And that's just, they're very important parts of vision, but they're only a small part of the whole visual process.
Mm.
And the nature of screenings is that they've got to get through a lot of kids in a fairly short space of time. So they're going to be picking on the more major eye and vision problems, things like eye turns, lazy eyes, and high prescriptions that you want to get onto early. And that's different from, well, one, if we're seeing a child of that age, there's so much more that we'll be testing because we're interested in how they process and perceive information. And in addition, doing more extensive tests of their eye health. But I think the important thing to understand is that if we're talking about the kind of vision problems that are going to affect learning, then many of those kids will pass a sight screening. And so the vision problems that they get are a lot more subtle, and so that's where it needs more extensive, comprehensive testing. And the other thing that can also happen is that the vision problems may start to develop once they're at school. So we need to be looking at things where they've genuinely passed a sight screening. They may even pass a full visual exam at 4 years old, but things can change and do change. So they can start to develop eye teaming problems. They can start to develop focusing problems, and they can start to develop myopia. And those are things that occur well after a sight screening's already been conducted. It might happen at 2 or 3 years down the track. So
Mm.
it's easy to fall into the trap of, um, you know, uh, my child passed the screening and everything's okay.
Mm.
I think we need to recognize that, one, it is just a screening, and things change.
So those kinds of screenings, so they don't necessarily like check what's going on inside the eyeball or at the back of the eyeball. That those are the kind of like examinations that you'd really need proper diagnostic tools for, which they wouldn't have, I guess.
Absolutely. Yeah. Yeah. So, the modern screening now with instrumentation, they're a little bit more sophisticated than they were, say, 20 years ago,
Mm.
where they can use instruments to pick up difference in the prescription between two eyes. So you might have a child who's very long-sighted in one eye, but you won't know about it because they see well with the other, and they're not showing any outward signs. Well, they have instruments for picking up those differences. But again, we're talking about picking up the 5 to 10% of kids who have sort of more obvious developmentally based eye problems. But yeah, it doesn't look at eye health and doesn't look at those subtle things around, eye teaming and tracking and things like that.
And I guess often the children themselves don't know if they have vision problems, so they're not gonna stick their hand up and say, "Dad, take or Mum, take me to the optometrist," are they?
Yeah. And look, they don't always, and they don't know what blur is.
Yeah.
And if they've been saying that way since they were younger, then that's their normal. I still remember having a young boy come in at 7, and this is back in the days where sometimes screening programs would come and go. They've been a lot more regular now. And he came in, and he seriously couldn't see letters on the chart that were this big.
Mm.
And looking at him, he looked perfectly normal. He rode motorbikes,
Wow.
and he was not able to see things this big and had no issues riding motorbikes. And so he was obviously, I think we saw him at 7 or 8 years old because they were starting to notice that he wasn't seeing the other kids were seeing in the classroom. But there was nothing about his behavior away from school that would indicate anything, because he was so used to seeing like that. That was his
Mm.
normal.
Yeah. Yeah, and it's not even just kids, is it? I mean, I think I got my first set of glasses as an adult, and I think everyone who wears glasses probably has a story like this. When I put my glasses on for the first time, I remember I was at the optometrist office, and it was like 5:30 in the afternoon or something, and I walked outside and I could see like the sunset in like vivid colors, and I thought to myself, is this what a sunset looks like? I've been missing out on it all these years. So sometimes you just don't know you've got a problem until it's properly tested.
That's right. Obviously, if something suddenly shifts, you've got a reason to, your brain picks up on it. But if you get these slow changes over time, then you kind of just adapt. And it's not until
Yeah,
you're confronted with something that you're performing differently to somebody else. And then I've got a similar story with, you know, seeing the leaves on trees that I didn't
yeah,
realize you were meant to until I got my glasses as a teenager and went, okay, I am meant to see that from this far away.
yeah.